day, the first vaccination for the COVID disease. We'll be able to see the first vaccination here at NYU. What's really important is that NYU has been the center for the trial here in New York City for the Pfizer COVID vaccine, and we're very proud of the fact that we've been involved in the creation of this vaccine, and I think it's really emblematic of what we do here in academic medicine and everything that we've done. And I'm here to tell you that this vaccine is first and foremost safe. All of the people, the thousands of folks who've been involved in this trial and everyone that's been involved can tell you it's going to be safe. And I think the most important thing that I can tell you is when it's my turn, I will be getting the vaccine, and I'm looking forward to it. And I think every New Yorker should take advantage of this, because this is how we're going to be able to get rid of this dreaded disease, and this an opportunity for all of us to get back to whatever normal is again. But we're looking forward to that. It gives me a great pleasure to introduce my friend, the Mayor of the City of New York, Bill de Blasio.
Excellent.
Mayor?
Thank you.
Thank you, sir.
Thank you. I want to thank Joe Lotta and everyone at NYU Langone Health for this amazing moment we're about to share together. But as you heard from Joe, also for the extraordinary role that NYU Langone Health played in helping make sure we all got to experience this moment and had a vaccine we could depend on. So thank you, Joe, and to you and all your colleagues. Everyone, this is a beautiful moment, a powerful moment. You're going to see healthcare heroes getting this vaccine. You're going to see them being protected so they can serve all of us. You're going to see a needle go in the arm, but that's not the shot that's most important. What really matters is we're getting a shot of hope. Here in New York City, all over the country, we're getting a shot of hope. We now know that we will ultimately defeat the coronavirus. To do that, everyone needs to be involved. And so our health department, led by Dr. Dave Choksi, is going to be out there all over this city, making sure that people get this vaccine, that it is fast and it's effective. We get out there to every corner of New York City, that the distribution is equitable. And we want to especially focus on those 27 neighborhoods that bore the brunt of this crisis in communities of color. So what you're about to see is the biggest mobilization in the history of New York City. You're about to see the biggest vaccination effort ever. The hundreds of years this city has been here and the amazing things that have happened in New York over the generations. This will be one for the ages. This will go into the history books. The greatest, fastest vaccination effort ever in the history of New York City, and it begins right here today. I feel we're all blessed to have this experience together. So let's go and let's start rolling. Let's start getting people safe in this city. This way? All right. Hey guys, you guys got to everyone, we'll make this work. Give us a second. There's a lot of you, right? Okay, so we're not going to start until everybody is ready. I promise. Oh, thank you. Yeah. The one thing is, remember, you're going to all be able to ask one question, which means can you all please silence your phones, because you're all using your shotgun mics, right? So everyone knows you'll hear that. Okay? So if you have a phone, please silence it, all right? Who is not ready to go? All of you are ready to go, all right? I'm going to step out of the way, and we're going to let magic begin.
Hi, my name is Brian. I'm a nurse. I'm living in 2013. Today, and it was very hard to make
Tara Easter, 62470.
Okay. Have you contacted the notification to the invitation register? Some of the side effects of these vaccines include injection pain, tiredness, headache, muscle pain, chills, joint pain, fever, and then swelling at the injection site, and injection redness, nausea, and sometimes feeling unwell. Now, the remote chance that the vaccine will cause a severe allergic reaction, that could be typically breathing, swelling of your face and throat, and a fast heart. Are you feeling sick today? In the last 10 days, have you had a COVID-19 test or have you been told by healthcare providers or health department to isolate or quarantine at home due to COVID-19 infection or exposure?
I had a test, it was negative, and I have not been told why.
Have you been treated with antibody therapy for COVID-19 in the past 90 days?
No.
Have you ever had a serious or life-threatening allergic reaction such as hives or difficulty breathing to any vaccine or shot? Have you had any vaccine in the past 14 days, including a flu shot?
No.
Are you pregnant or considering becoming pregnant?
No.
Do you have cancer, leukemia, HIV, AIDS, a history of autoimmune disease, or any conditions that we can see immune system?
No.
Do you take any medications that affect the immune system, such as cortisone, prednisone, other steroids, anti-cancer drugs, or any, do you have any radiation treatment?
No.
Do you have any questions?
No.
You seem very knowledgeable.
And which side is the first question?
I guess left. To the right, each the left.
All right, we're ready.
Classic. Yeah, that's all right. I knew you'd be that. You didn't flinch at all. Nerves of steel.
All right.
Because
so
I have
we're
a
gonna-
good nurse.
Well, I'm sorry. Go ahead, I apologize.
Okay.
Okay, so we're gonna start now one at a time. Remember, you can ask one quick question. Each outlet will go one quick question each, and then we will go to the next part. Okay, so can we just start on this side of the room and get, yep, that's great. So that would be you here on the first X on my left-hand side. Are you ready for your question?
Yes, yes.
Okay?
So now that you have the vaccine, and what are you going to do once life gets back to normal?
That's a really hard question, I guess. Well, I think it's very exciting, and I just hope that, everybody gets it, and like everybody said, we all get back to normal.
All right, next question, please. The next person? Yes, go ahead.
Hi. How will you recommend the vaccine to patients and your family now that you've taken it?
I would have recommended it probably before I got it, but it really was nothing. Maybe because Frank did such a good job, but it really felt like nothing.
All right, go ahead.
Tara, you're a great nurse and you do a great job in the ICU. I know you. How do you feel about those who didn't make it to this day to get the shot but got sick because the shot wasn't yet here?
I think, it was a very challenging time. Lots of patients and families went through a lot. So again, today's really exciting that we can move forward and hopefully patients and families can take advantage of it.
All right, right here, please. Do you have someone asking a question, sir?
No, that's it.
Okay, great. Why don't you go ahead?
Tara, how does it feel to be fortified against a virus you've spent so long fighting?
It feels good. This is the first of 2 vaccines, but I feel very lucky.
All right, next question in the front row.
After all that you and your colleagues have been through over these last few months, did you think this day would come as quickly? And what was your reaction to learning that this would be available for you and you'd go first?
It really was amazing to hear how quickly this happened. And personally for me, I'm really looking forward to my frontline staff getting it. They are in the first wave, and some of them are actually getting it today, which is really exciting and really important for them who are really out there taking care of all the patients.
All right, next question right in the row here. That would be you guys. Oh, sorry. You guys? Okay, do you have a question? That's done. No question? Any question? Everybody's cool?
Yeah, I'll ask you, Tara.
Okay.
What's the mood among your colleagues, fellow nurses and doctors, knowing that the vaccine is available?
Everyone has said it was, one of the most challenging times they ever faced as nurses, the whole team, the whole interdisciplinary team. I think everybody, even though numbers may be increasing and creeping back up, everyone feels a lot more confident this time around, more equipped. But again, to the point of the vaccine, very excited to have the opportunity to get it.
All right, there's one other question, even though, go ahead.
What do you say to those who may be skeptical or even scared of taking this vaccine now that you've had the first injection?
I think, those that are scared should, think about it, research it, look at the data. But I would encourage them that it is very safe. If you look at the studies and what's been presented, especially here, and I would encourage them to take it.
All right, is everyone good? Okay, so let's talk about the next stop. So everyone leaves the room, except at this point. Are you going to handle? Okay. Everyone, please leave the room. You will then be taken moments from now to your second stop everyone stays in the hall and we'll come and get you, okay? Please stand on an X outside, do not gather.
Oh, no kidding, look at that. Yeah, sure.